Hey everybody, Dr. Kevin again here, and welcome to day 6 of our spine rehabilitation program. Where over the course of 30 days, I hope to help you create what I believe is a very comprehensive spine rehabilitation program designed to help you increase your mobility, increase your strength, and just improve your overall body awareness and confidence in what I believe are the safest, simplest, and most effective ways possible. And again, this is just a culmination of just some of the experiences and some of the lessons that I've learned over the course of 12 years in working with patients who are struggling with chronic neck and shoulder pain or just a lot of chronic lower back ailments. And just want to just give a very quick recap of the first couple of days and just lay out the framework for day 6. So the first 4 days, we just went over a lot of material, breathing exercises, how to integrate breathing into our stretches, how to just make sure that we're not just kind of going through the motions of certain exercises, and that we're really using our exercise as a means to just explore, just pay attention to areas that might be stiff, might need a little more work, or areas that you actually are able to move well, and just to get a feel for what your body's actually lacking, what it actually needs. We then started to go over a lot of mid-back, or also known as thoracic spine movements. Again, because I just feel that in almost 90% of the patients that I work with are people that are just struggling a lot in that mid-back area. This is just due to a lot of people who are struggling with posture, sitting at a desk, working over a computer over the course of many, many years. And most people are just generally unaware that they've lost mobility in that area. And what ends up happening is because they've lost mobility in that area, their neck and shoulder or lower back have to overcompensate for the lack of movement, for the lack of just functionality in that mid-back area. So when we're actually able to make gains and start to improve improve mobility in the area for my patients, a lot of problems just seem to go away. Their posture improves, their breathing improves, their overall mobility improves, and things really just start to get better once we start to work on creating better movement in that mid-back area. So that's what we're going to focus in on today in day 6. We're not going over any new material. This is just going to be a recap of exercises that we've done in the first 4 days, working specifically on the middle part of the back. So again, if you're just looking for a good plug and play, 12 to 15 minute routine of just getting through a series of exercises and stretches for the mid back, then this is the video for you. If you need a little more clearer instructions, or if you need to just kind of slow it down, or just want to work on one segment of the exercises more specifically, then you can just kind of revisit one of the more previous episodes where I give more detailed instructions. But this is just going to be just kind of jumping right in, just getting through the exercises, and just again giving you a good 12 to 15 minute routine to help you increase mid-back mobility, again to increase posture, improve your reduce stress from your neck and your shoulder, reduce stress off of your lower back, and just fully improve the overall functionality of your spine. So let's get right into the exercises for today. Okay, let's start with the first exercise for today. We'll start with my personal favorite, which is creating extensions over the roller. And again, just to provide a little bit of recap, a little bit of context, if you can remember, the mid-back or the thoracic spine is comprised of 12 vertebrae. And as I work on this exercise, I want to be just breaking down the spine into 3 segments. So it'll be the first 4 vertebrae here, which is known as the upper thoracic spine, followed by the second, third vertebrae, which is known as the mid-thoracic spine, and then the last 4 vertebrae, which is known as the lower thoracic spine. So I want to make sure that I'm doing some extension exercises across all those vertebrae, just make sure that I'm hitting all of the different segments, okay? So all you need to do is just lie in the roller. Just tuck my shirt in real quick here. And start by just rolling up and down, just to get a little bit of massage, release a little bit of pressure and tension from some of those muscles. And then also identify the areas where you just kind of feel are really tight or really stiff, or where you want to spend a little more time in. We'll start with just the upper area through here. And again, this is the first 4 vertebrae, not on my neck, just below my neck, right on the tops of my shoulder blades here. I want to hold my head to support my neck to make sure that I'm not hinging from my neck too much. And again, just doing a nice gentle back bend over the roller. And if you get a little if things get a little stiff, if you get a little stuck, if it gets a little tight, just stay right there for a couple seconds. Breathe. Exhale. Just gently push down into a deeper stretch. All right, not forcing it. Just try to let gravity just kind of pull your head and pull your spine gently into this back bending position. Nice deep breath in. Exhale. Go into a deeper stretch. Again. Exhale. We're going to go for 5 breath cycles here. All right, so we're just going to breathe 5 times. This is number 4. On the exhale, let's go a little further into the stretch. All right, I'm wiggling around a little bit. All right, you can just kind of stay still if you want. It's up to you. Breathe in, breathe out. Come as close as you can to the floor without forcing it. Just try to just let gravity and just let your breathing just kind of guide how far you feel comfortable going. Okay, so let's move the roller down a couple segments and let's target the mid part of my upper back. So just roll up and down a little bit just to kind of prime and warm and loosen up those muscles a little bit. And then we'll bend back. Go as far as I can. Once you get a little tight, get a little stiff, start to get a little stuck, take a deep breath in. Exhale. And we'll just repeat a couple more times. Okay, that's 4. And we'll just do one more breath cycle. Deep breath in. Exhale. That's 5. Okay, come back up. Roll up and down a couple times. And then we want to just position the roller just a little bit lower onto those lower segments. Just be careful not to make sure the roller doesn't go too low onto your lumbar or your lower back. You'll know you're too low if you bend back, if you start to feel a lot of pressure or a lot of hinging or just discomfort in your lower back. If that's the case, just move the roller up your back. I'd rather it be a little bit too high than a little bit too low. But a good place for you to know you're on the right spot is just kind of at the bottoms of your shoulder blades and kind of where your rib cage ends. If you're off of your ribs and you're kind of on your lower back, I wouldn't advise or recommend that you do extensions from there. Make sure we keep this in the mid-back or thoracic area. Okay, so right here feels like it's a good spot for me, and we'll just do a couple back bends from here. Deep breath in. Exhale. A little too low there, so I'm going to move it up a little bit. Inhale. Exhale. We'll do 5 breaths at this segment too. Inhale again. Exhale. My exhale is what's going to help me drive into a deeper stretch. And wiggle around a little bit just to test, explore new movements. Let's do 2 more breaths. Inhale again. Exhale. And one more time. So that's it for mid-back extensions. And now we're going to get into some other twisting, extension, other rotational-based movements that you can start to do to increase mobility in your upper back. So let's get right into the next series. The first exercise is the open book. And here I just want to use a pillow here just to provide a little bit of extra support for my neck. And I advise you to even maybe double up the pillow here just to keep your neck in a really kind of nice, comfortable position. If your neck is too far down or if it's too kind of pushed up, that's going to increase a lot of pressure on the neck. So to make sure that your head and your neck is in a nice kind of neutral position, so it's just the most relaxed that it can be. To start this exercise, I want to bring my knees up towards my chest and use this bottom here to block my top thigh. And what this is going to do is going to prevent any unnecessary twisting and rotation from happening through my lower back here. So I'm going to take my right hand and open up my shoulder, open up my chest, and I also want to turn my head and my neck towards the right. And once I start to get a little stiff, once I start to get a little stuck, I'll take a nice deep breath in, exhale, let's go into a deeper stretch. Again, breathe in, breathe out. That's 2 breaths, and we'll do 5 breath cycles. Exhale. Each time I exhale, I'm just going to go into a slightly deeper stretch. Inhale again. Exhale. Feel free to take your time if you're just in a comfortable position, if it feels good, if your body feels it's just kind of doing some good work here. Don't rush, just stay there for a couple seconds, just let your body adapt and adjust to the new movement. Nice deep breath in, exhale, all the way to the ground. Okay, let's go to the other side. So this time I will be laying on my right side. I'll pull my knees up towards my chest. My right hand will block top of my thigh. My left hand will be free. And I'm going to turn my head and my neck, turn my shoulder all the way to the left. Go as far as I can. Once things get a little tight, again, I'll use my breathing. Exhale. And just slowly relax into a deeper stretch. Inhale again. Exhale. Feel a nice stretch through the pec, front of the shoulder here. A little bit of stretching in the mid to upper back through here. Deep breath in. Exhale. The goal is for me to be able to touch my hand all the way to the floor. If you can't get all the way there, that's completely fine. Just stay within your limits and just use your breathing to guide you into a deeper stretch as far as you can tolerate. Couple breaths here. Hanging out here feels pretty good. Don't have to rush it. Last breath in. Exhale. All the way to the floor. Okay. If for any reason your shoulders feel too uncomfortable with this stretch, all you need to do is just put your hand by your rib cage and just kind of pull your ribs along, and you'll still get the same twisting and rotation of the spine with a little less pressure on your shoulder. So this is a good modification if you have any shoulder issues that that you don't want to get worse by doing this stretch. Okay, so twisting with the rib pull, breathe in, exhale, just pull those ribs down and try to get your shoulder blade all the way to the floor. One more time. Okay, so that's it for the open book to increase thoracic twisting and rotation. And then we're going to get into the last exercise for mid-back mobility day. Okay, so the last exercise for day 6 is going to be just a review of the reach back exercise. This is probably the most difficult of the 3, but also I believe one of the most rewarding if you're able to start to make some progress towards increasing your ability to twist and rotate through the stretch. So let's get right into it. So to start, you'll sit with your hips down into your heels, And we'll do the right side first. So I'll place my left hand right between my two knees through here. And I'm going to put my right hand behind my head. And I just want to, again, just kind of twist and start to reach back. And eventually I want to try to see if I can get my elbow to be able to point towards the ceiling. But again, if you're tight, if you're restricted in this area, you might start to get a little stuck about somewhere along here. Again, the goal at this point is just to take a couple of nice deep breaths. Exhale. Just slowly work in towards a deeper stretch. That's 2. And you want to just aim for about 5 deep breath cycles. Each exhale, just try to push a little further into the stretch. A little more challenging with this stretch because I want to just engage more muscles, just to create more leverage, just to create more activation of those mid-back muscles through my ribs and through my sides. And it's a little harder than the passive stretch, such as the roller and the open book. It's 4. And that's 5. And let's work on the other side. So hand behind my head. Let's start to reach back, open up my elbow towards the ceiling. Once I start to get a little tight, once I get a little stuck, take a nice deep breath in. Exhale. It's 2. I'm also pushing off this bottom hand a little bit and just trying to create a little more twisting movement through my spine. You might feel a little activation, a little tightening along the muscles along your sides and your ribs. If so, that's completely fine. If you have any pain in the neck or any pain in the lower back, just back off a little bit. It's 3. Just stay here for a couple seconds. Just let your body get a chance to just adapt to the new movement. When you're ready to advance, take a nice deep breath in. Exhale. Just open up as much as you can. Okay. In the event you start feeling maybe some tightness or just some discomfort in the muscle on the top of the shoulder, one way to easily modify this stretch is to just simply put your hand behind your back like so, and make sure that as you're opening up that your shoulder isn't kind of slumped forward like so. You really want to try to pull your shoulder blade back and eventually try to point your shoulder and your elbow as close as you can towards the ceiling. A little easier in the neck and the shoulder through here. Same thing, just take a nice deep breath in. Exhale. Just open up. Let's do it 2 more times. And last one. Okay, so that's it for the mid-back series. Again, almost 90% of the patients that I see who are struggling with neck or shoulder or lower back issues have a lot of tightness, a lot of rigidity in the middle of their backs. But some of the most significant progress we're able to make with our patients is once we start to get some better mobility, strength, and activation along the middle of the back, because again, it just helps take so much pressure off of the neck and the shoulder and off of the lower back. It's something that we will continue to revisit time and time again throughout the course of this program. But if you need just a 15 to 20 minute routine just to start to open up the middle part of your back, I promise it'll help you improve your posture, it'll improve your overall mobility, and just the overall health and connectivity and just the overall motion within your spine. So hope you enjoyed day 6, and we'll hope to see you again in day 7. Take care and have a wonderful day.